HIV/AIDS by Juliana Kozo. HIV is human immunodeficiency virus. It destroys your CD4 cells and makes duplicates of HIV, which causes the destruction of a person's immune system that leads to AIDS if not treated. AIDS stands for Acquired Immunodeficiency Syndrome. If HIV is not caught or treated in time, it will attack your immune system and cause the illness. Here is a visual explanation of what happens to the cells in your blood when you acquire HIV. You can get HIV from having sex without a condom. It could be passed from mother to baby, sharing injecting equipment, and this is common with drug users. It leads to high-risk behaviors and can be passed on from dirty needles, blood, etc., and contaminated blood transfusions and organ transplants. This is becoming less common, but still possible. HIV is not transmitted by insect bites, toilet seats, kissing, sharing cutlery, or touching. There's unfortunately no cure for HIV or AIDS yet, but there is antiretroviral therapy, also known as ART. It's a combination of medications that will prevent the spread or growth of the virus, but it is not a cure. It used to be many more medications, but as time goes on, it's less and less, but they're having the same impact. When you're doing ART, the goals are to get the number of CD4 cells up to improve your immune system and to decrease opportunistic infections. This is a graph of deaths and people living with HIV. As you can see, the number of people dying and living with HIV increased all the way to the mid-90s. And once about 1995 hit, the deaths significantly decreased and the rate of survival increased. This shows that the antiretroviral therapy was working because it was around the time that it was introduced. There are ways to prevent HIV. Primary prevention reduces the possibility of transmission, so less people get infected. And some examples of these are handing out condoms, putting up billboards, just abstinence from sex and drugs, because again, you can get HIV through injecting, and to be cautious when using intravenous drugs. Secondary prevention lowers the severity and commonness of the disease by early detection and fast action. Therefore, less people will get HIV, and that leads to AIDS, and less people will get that as well. Examples is the antiretroviral therapy, regular therapy, and diet and exercise to keep your body healthy and active and strong. Tertiary prevention it's to prevent the disease progression after it's already diagnosed. So after you have gotten AIDS, it's to help the patient just with their mental health, with their physical health overall. It's afterwards that you've known you've had the disease. Epidemiology of men. According to the CDC from 2016, there's an estimated number of 38,000 new cases of HIV just in the United States each year. About 78% of those were MSM, which means males that have sex with males. It is shown that there is a higher rate of HIV between MSM than heterosexual men. And of men with HIV, 39% are black, about 14,700, 35% are white, about 13,200, and 22% are Hispanic or Latino, about 8,500. Epidemiology of women. Also, according to the CDC, in 2016, women were 19% of the new HIV diagnoses in the U.S. 87% of the women diagnosed contracted HIV through heterosexual contact, which means they had sex with men. 12% of the women diagnosed, it was from intravenous injection, which is drug use. And of the women with HIV, 61% were black, 19% were white, 16% were Latina, and 5% with other. Epidemiology of pregnant women, infants, and children. In 2006, about 8,500 women with HIV gave birth. From the beginning of the spread of HIV until 2014, There were almost 5,500 deaths among people that acquired HIV through perinatal transmission, leading to AIDS, and 82% were 13 or younger. Perinatal transmission is the transmission through placenta or breast milk from mother to child. At the end of 2014, more than 9,500 cases of HIV was spread to children through perinatal transmission age 13 or younger. Epidemiology of transgenders. The CDC gave over 3.3 million HIV tests in 2013. The number of diagnoses was 3 times the national average at that time. This is a graph of the different races and the percentage of those races that were diagnosed with HIV. Epidemiology, time, and place of Congo. I chose Congo because it is where HIV originated from, and I chose the years 1995 and 2016 because 2016 is the most recent data, and 1995 because that's the year, as the graph showed earlier, that the rate of HIV drastically changed. So as you can see, from 1995 to 2016, the number of cases for males and females under 5 was just about cut in half. But the number of women ages 15 to 49 went up between those years. So I'm not going to go through each case, but you can see there are different relationships between the ages and the years. Epidemiology, time and place in the United States. You can see that the numbers in the U.S. overall are significantly lower than Congo. I'd like to point out that males 15 to 49, the numbers dropped an incredible amount. And I think that antiretroviral therapy is a big part of that. And because it's becoming more accepted with the different times and people are becoming less and less afraid to speak up and actually get help. And I'd also like to point out that harm reduction, like needle exchanges, have been going on to help reduce the amounts of needle transmission of HIV, and I think that's a big reason why the female rates have also gone down. Substance use and high-risk behaviors. Using drugs intravenously while sharing a dirty needle spreads HIV, and that also has to do with the harm reduction spread of HIV. Needle exchanges, for those who don't know, they are clinics or offices or even stores that will give out clean needles for those who are using. It's a very controversial topic, but it will decrease the spread of HIV. So it is called harm reduction, and it gets dirty needles off the streets. It spreads less. It is a help. Injecting drugs caused 9% of the 39,000 HIV diagnoses in 2016. And a big percentage of that was women. About 13% of AIDS diagnoses in 2016 were from injecting drugs, so that was a big part of HIV. And about 1 in 23 women and 1 in 36 men who inject drugs get a diagnosis of HIV. So that's a pretty large number. And this is just a graph showing the percent of people who inject drugs by race. And it's showing that fewer blacks and more whites are starting to inject drugs. And in other classes, we've learned about how these types of drugs, like heroin, meth, drugs that you inject, are more common in higher class neighborhoods, while drugs like marijuana, even though still considered a Schedule I drug, are more common in the lower class neighborhoods. Disease and untreated mental illness. Asymptomatic neurocognitive impairment, or ANI, is a mild neuropsychological impairment, and it does not affect everyday life, and it's likely to lead to mild neurocognitive disorder. It doesn't really affect your everyday life. You have some symptoms, but it's not something that really ruins your day-to-day life. Mild neurocognitive disorder is mild neuropsychological impairment, and there is a decrease in everyday functioning, but it's nothing that you can't, that ruins how you act every day. It just decreases your quality of life. And then it leads to HIV-associated dementia, or HAD. This is an overall decrease in neuropsychological impairment, and it's a major decline in everyday functioning. As many of you may know, dementia does lead to death. It does impact your brain a lot, and this is an image of what dementia in HIV patients look like. So as you can see, it's very, very different. And this is just an image of the percentages of people with ANI, MND, and HIV-associated dementia. And here's a few interesting facts. HIV was first reported in the U.S. in the mid to late 1970s. It was not accepted at all. If you ever watched the movie Philadelphia, it has Tom Hanks. It's an amazing portrayal of that time period and HIV and how it was not accepted. Before the U.S. knew what HIV or AIDS was, the people were being diagnosed with things like cancer and pneumonia because scientists did not know what it was. As the time went on and there was more science and further investigating, they realized it was AIDS, and AIDS was caused from HIV. And lastly, HIV is more common than people think. It can affect anyone. Don't be afraid to get tested for HIV or other sexually transmitted diseases or infections, because it can save your life and your overall quality of life. Thank you.